In America, you don't really own your life anymore. You rent it from health insurers. But as if that wasn't enough, they're not even the biggest threat anymore. In 2006, 3 private equity firms bought the largest hospital chain in the country for $33 billion. And the target of the buyout was Hospital Corporation of America, one of the largest for-profit hospital operators in the US. Private equity firms put in around $5 billion initially and financed the rest with debt. And once the deal was finalized, HCA now assumes $16 billion in debt along with their previous $12 billion in debt that they already had. Fast forward to today, and private equity now owns 488 hospitals across America, over 6,000 doctor practices, and roughly 750 nursing homes that your grandma is rotting away at. And since that deal, it started a gold rush of private equity healthcare deals, where by 2018, private equity accounted for nearly 45% of all hospital and emergency department M&A deals in the country. They found that elective surgeries, dermatology, dental clinics, orthopedics, and well-insured patient populations were more high margin. Because remember, the whole goal of private equity is making sure that whatever they purchased and own now is valued more on paper, so then they can sell it later for profit. But here's where it gets worse. Because now that these hospitals carried a lot of debt, a lot of cash now had to be diverted from what was previously for patient care to these interest payments. To meet their aggressive return targets and to pay back that debt, private equity-owned providers frequently raise prices, increase billing, or boost service volumes. After a private equity takeover, patients were more likely to suffer infections, suffer from falls, or even die. A study found that following acquisition, private equity acquired hospitals were associated with significantly worse patient outcomes and even surgery infections. So it's pretty clear by this point that everyone pays the price, whether through more expensive care or through your tax dollars. Well, the deeper I looked, the more I realized that healthcare is not broken. It's working exactly as private equity intended.